How are you going, Emily?
Good. Just takes a while to get used to everything and settle in.
Well, you'll let me know if I can help you in any way.
Thanks.
Not sure if you're aware of this, but we're reviewing our fall prevention program here. We're looking closely at incidents and trying to identify ways in which we can improve. So I thought this would be a good opportunity to catch up with you, see how you're going, and we can go through Mr. Tannis's incident report.
Sure, okay.
The medical review, conducted straight after the fall, ruled out a cardiac cause. There were no signs of a rhythm disturbance or a postural BP drop. So there were no specific medical reasons for the fall, and thankfully, no injuries. But even though Mr. Tannis is now physically okay, he's anxious and he's afraid to move around on his own. And of course, there was always the potential for serious injury. So we really need to work out why it happened. I think it was a combination of extrinsic and intrinsic risk factors, plus the actions of some staff members that contributed to his fall. So what I'd like to do is to go right back to the beginning, from Mr. Tannis's admission onwards, so we can find out what we could have done better and what else we can do to help reduce the chances of him falling again.
That'd be good.
All right. Now, can you walk me through Mr. Tannis's admission?
He was brought up this time yesterday, and I checked his room, made sure it was free of clutter and the bed breaks were locked. The emergency department nurse said that Mr. Tannis was being admitted for an investigation of chest pain, and he was able to transfer independently with his walking stick. He also said that he didn't require an interpreter. Oh yeah, and I remember Gary said something about a drink being spilt before he left.
Emily, I just cleaned up a drink spill outside room 510.
Right.
I put the wet signs up so everybody knows. Just be careful if you head up that way.
Sure. Hi, Mr. Tannis. I'm going to get you to stand up. I asked Mr. Tannis to stand and walk a short distance for me so I could check his mobility, and he was very confident.
Please, can I...
He asked to use the toilet, so I showed him where it was and explained how to use it safely. Then he returned to his bed and I explained how to use the call bell and where he could place his belongings so that they were within easy reach. And next we went through the necessary admission paperwork. A couple of things stood out to me. His chronic medical conditions and the number and type of medications he was taking.
I noticed on his medication chart that he took 2 sleeping tablets before bed. Now, I think this could have been part of his problem last night.
But this was his usual dose?
Well, sleeping tablets are a fall risk factor because of their side effects, like reduced mental alertness and impaired balance.
OK, well, I can discuss his sleeping tablets with Dr. Hall and monitor Mr. Tannis more closely during the night. I'll also make a note on the care plan and tell the other staff in handover.
OK, that's a good idea. Another thing we can do is to speak with Mr. Tannis and his family about alternative methods to help him sleep. Now, what happened after you went through the admission paperwork?
Then I went through a full risk assessment. I have a few more questions, and these are to assess your risk of falling during your stay here. Have you had a fall in the last year?
10 months ago, maybe, I go downstairs, I missed my foot.
After completing the questions, I decided to recommend a few interventions. Well, Mr. Tannis, I'd like to talk to our team to see if we can work on a few of your health issues. For example, a podiatrist about your foot pain and a pharmacist to talk to you about your medications.
Excuse me.
Jason had an emergency and needed my help, so I had to leave at that point. OK, just excuse me. OK, great. Enjoy. Mr. Tannis was having dinner when I got back. We had a quick chat and I left a fall prevention brochure with him. I checked if he wanted a version in Greek, but he said he was fine with English.
You tell me when you want me to stop.
Thank you. That's fine.
Okay.
Thank you.
I'm pretty sure it was about 9 p.m. We'd had a really busy night and I'd only just managed to get away from my break. So Jason gave him his sleeping tablets and helped him settle for the night.
Okay. Good night.
Did you read through the brochure with him?
Well, no, he said he was fine with it.
We use an orange wristband here for patients assessed at a high risk of falling. Did Mr. Tannis have that orange wristband on?
I didn't know about the Falls Alert wristband. And anyway, after observing his mobility, I felt he was very confident with his walking stick and independently mobile.
Well, according to the risk assessment tool, the combination of his medications and a fall within the last 12 months put Mr. Tannis at a high risk of falling.